Treatments for aging and mature skin. The mature client's skin can be improved, but the natural aging process cannot be reversed, nor will the skin be restored to the same vital condition of youth. The client should be advised that treatments can make the skin look and feel better, but there are no miracle treatments that restore aging skin. Figure 8.44. Prevention and healthy habits are the key to beautiful skin at any age. Figure 8.44. There are no miracle treatments that restore aging skin. Elasticity of the skin. Aging skin often lacks elasticity. Elasticity is the skin tissue's ability to return to its normal resting length after a stressor has been removed. One way to test the skin for elasticity is by taking a small section of the facial skin or neck between the thumb and forefinger and giving the skin a slight outward pull. If the elasticity is good, the skin will immediately return to its normal shape when the skin is released. If the skin is slow to resume its normal shape, it is lacking elasticity. Firming ingredients and treatments are beneficial for skin's elasticity. Ingredients for mature skin. Aging or sun-damaged skin needs antioxidants topically and orally. Antioxidants such as vitamins A, B3, C, and E, minerals, green tea, and grapeseed extract all help protect the body from free radicals. Other beneficial care for aging skin includes protecting the barrier function of the skin and wearing sunscreen. Additionally, alpha-hydroxy acids can help combat the signs of aging and sun damage. Hydrating ingredients such as hyaluronic acid, sodium hyaluronate, sodium PCA, and glycerin all bind water to the skin and retain the moisture that is essential to maturing skin. Peptides, lipids, polyglucans, coenzyme Q10, and liposomes are all beneficial performance ingredients. Treatment goal. Hydrate and revitalize the skin. Establish regularly scheduled skin evaluations that include skin analysis and review with the client in order to make the appropriate product and treatment adjustments. An ongoing program of anti-aging treatments done in a series. Mature skin treatments. Here are some suggestions for treating mature skin. Use procedures similar to those designed for dry skin, adapting the ingredients to include ones that help reduce the appearance of fine lines and wrinkles. Extended massage with a moisturizing serum and cream. Peptide, collagen, and hydrating masks are all beneficial in a facial treatment for mature skin. Sensitive and sensitized skin or rosacea. Our skin, the largest organ in the human body, has a remarkable multifunctional capacity to not only maintain our internal environment but to interact with environmental stimuli such as microbes, chemicals, and other physical elements. Any of these environmental stimuli may evoke a reaction of the skin, leading to dermatitis, an inflammation of the skin. In addition to redness, erythema, edema, swelling, inflammation, and dryness that is characteristic of dermatitis, sensitive skin also experiences a cascade of free radical activity that causes skin-destructive enzymes to form. Figure 8.46. These enzymes attack the skin's integrity, leading to premature aging in the form of wrinkles and loss of elasticity. Figure 8.46. Sensitive skin. As learned in Chapter 5, Skin Analysis, sensitive skin can be a biologic condition that readily reacts to a variety of factors such as specific chemicals, airborne debris, and/or certain skin care ingredients, resulting in skin that often appears blotchy, broken out, or excessively dry. Dry patches and redness are often present with this type of skin. Skin can easily become red and warm to the touch. This skin type can be confused with rosacea or cuprose skin types. Did you know? Rosacea is more common in adult females than in males. However, when a male develops rosacea, it usually becomes quite severe. Sensitized skin can result from overaggressive exfoliation, or from exposure to aggressive environmental factors such as cold, wind, low humidity, and air pollution. This skin may become highly sensitive and needs to be treated as sensitive skin until it returns to its normal state. Avoid inflammatory ingredients until skin has returned to its normal state. Irritants and sensitizing ingredients can be essential oils, exfoliants, fragrances, color agents, and preservatives. All of these may cause skin reactions and irritation. Rosacea. Estheticians cannot treat or diagnose any medical condition, and rosacea is considered a medical condition. This condition typically manifests as redness in the central area of the face, including on the cheeks and nose in a butterfly pattern, and it is characterized by flare-ups and remissions, figure 8.47. Over time, this redness can become more persistently visible. Broken blood vessels can also become more apparent. Left untreated, pustules and large, inflamed nodules can result that are often misdiagnosed as acne. After a prolonged period, this condition can result in permanent enlargement of the nasal tissue or rhinophyma, where the tip of the nose becomes enlarged and red. Eyes can also become affected, appearing watery and bloodshot. This skin condition can be exacerbated by factors such as alcohol, spicy foods, and heat, making its symptoms similar to hypersensitive skin. While estheticians cannot treat rosacea, they must know how to properly provide a facial for a client with rosacea. More information on rosacea is in Chapter 4, Disorders and Diseases of the Skin. Figure 8.47. Estheticians cannot diagnose or treat rosacea. Caution. Contraindications for sensitive or sensitized skin, or rosacea. Individuals with sensitive or sensitized skin, or who have rosacea, should avoid the following. Strong exfoliants such as coarse manual materials, microdermabrasion, aggressive AHA or BHA peels, vacuum suction, the brush machine, and any ingredients with a pH of 3.5 or lower. Steam during treatment. Stimulating machines or manual massage. A cooling massage device can be used in place of manual facial massage, which can be manipulated to be gentler on the skin. Drying products with a pH of 8 or higher. Excessive heat such as hot water, steam, or towels, lukewarm water should be used during facials. Treatment goal. Identify and avoid those stimuli that provoke a sensitive, sensitized, or rosacea response. Provide skin with topical application of ingredients that help calm and soothe the appearance of the skin, such as seaweed, silver, quercetin, rutin, olive oil, olive leaf extracts, calamine, calcium carbonate, green tea, and allantoin. Help maintain the skin's protective moisture barrier by using fatty acids, ceramides, hyaluronic acid, niacinamide, linoleic acid, squalene, phospholipids, lecithin, evening primrose oil, tocopherol, vitamin E, and ascorbyl palmitate, vitamin C, and low percentages of an AHA such as lactic acid. Encourage the client to consult a dermatologist when experiencing severe sensitive skin or rosacea flare-ups. For home care, advise these clients to avoid vasodilators that dilate capillaries, heat, the sun, spicy foods, and stimulating products. Treatments for sensitive and sensitized skin or rosacea. Follow the facial procedure and incorporate the following guidelines. To lessen the appearance of irritation, a gentle cleanser is the best type of cleanser. Detergent-based cleansers can strip the skin's lipids and barrier protection. Cold towels are vasoconstricting, vasoconstricting, which means they constrict capillaries and blood flow. An enzyme peel formulated for sensitive skin gently exfoliates the skin. A soothing cream or alginate gel mask is great for calming and toning down the appearance of redness. Calamine and calcium carbonate powder mixed with aloe or fresh yogurt are also excellent for sensitive skin. Freeze-dried collagen masks are also excellent for redness or sensitive skin. Lipids such as olive oil extracts and seaweed help to create a moisture barrier on the surface of the skin. Use a serum and moisturizer with hyaluronic acid or squalene to help soothe the symptoms of sensitive skin. Silver ball or cold globes may be used to calm blood flow and reduce redness. They provide a gentle massage with controlled pressure to help both massage skin and apply product. Figure 8.48. Cold globes calm the skin. Treatments for hyperpigmentation. Hyperpigmentation is a condition that affects many people. Sun exposure, medication, and chemical reactions cause dark pigmentation areas on the skin that clients often want to diminish. Figure 8.49. Advise clients that the best preventative measures are to stay out of the sun and wear protective clothing and sun protection daily. Figure 8.49. Advise clients with hyperpigmentation to avoid the sun. Follow the facial procedure and incorporate the following guidelines. Ingredients that can help brighten the appearance of the skin include kojic acid, alpha-arbutin, glycolic acid, mulberry, licorice root, azelaic acid, bearberry, and citrus such as lemonwork to help reduce the appearance of dark spots. These ingredients can be used in conjunction with exfoliating treatments using AHA, BHA, and other types of exfoliators. Figure 8.50. Figure 8.50. Exfoliating treatments can help brighten the skin. Harsh skin bleaching agents such as hydroquinone, which is banned in several countries, may damage the skin and are controversial. Remember that over-exfoliating can cause damage and make hyperpigmentation worse, or conversely, cause hypopigmentation. Hypopigmentation results from reducing the appearance of melanin to the extent that lighter skin patches are now evident. Treatment goal. Chemical exfoliation and brightening agents can be effective in reducing some hyperpigmented areas. Treatments for oily skin. Oily to combination skin is caused by overactive sebaceous glands and is thicker in texture. The skin has enlarged pores that may be filled with sebum buildup from the environment as well as from the use of comedogenic makeup and other products. Figure 8.51. Comedones and whiteheads are present. The skin is sallow in appearance and is more prone to blemishes but is less prone to wrinkles and fine lines because the oil acts as a lubricant and a barrier, helping to keep moisture within the skin from evaporating. Figure 8.51. Enlarged pores may be filled with sebum buildup. Treatment goal. This type of skin can develop breakouts easily, so it is important to treat the skin with effective deep cleansing and purifying products. Galvanic current, steam, and extractions can benefit oily skin to keep the pores free of comedones, and exfoliation with oil-controlling ingredients and BHA can lead to a great result as well. Check in. List a treatment goal that is beneficial for dry skin, dehydrated skin, mature skin, sensitive skin, hyperpigmentation, oily skin. Acne treatment. Excessive oily and problem skin is one of the leading reasons clients seek out professional help and is one of the most important factors in an esthetician's practice. While estheticians do not diagnose acne, they must be aware of this skin condition and know how to properly provide a facial. Performing consistent effective facial treatments will not only benefit the client's overall appearance but will also help bolster their self-esteem. Both of these results are perhaps the most important achievements to which an esthetician can aspire. Caution. Physicians prescribe medications that work to suppress acne flare-ups. However, medications can have adverse side effects and, even with medication, acne can return. Working with problem skin is a continuous process, and clients need to follow regular skin care programs. The esthetician can outline an acne treatment plan to balance the skin. Treatments are focused on deep cleansing and extractions. Clients need to understand that they did not get their acne overnight, and it will not go away overnight. Likewise, clients need to be instructed to never pick at their acne pimples. Estheticians should also look for indications of acne excoriae, a condition stemming from habitual, nervous picking of the acne pimples that leads to permanent scarring. In order to partner with the client on proper care of their skin condition, instruct them on the histology of acne within the skin. Provide simple illustrations on how acne pustules form, such as in Figure 8.53. In this illustration, keratinized skin cell debris, plugs, A, block sebum from wicking out along the hair shaft. Stagnant sebum, B, is broken down by bacterial enzymes into short-chain fatty acids. An irritated papule, C, is formed. Increased blood flow activates the immune system, D. Finally, white blood cells rush to the area to combat the foreign matter, resulting in infections. Pustules are formed. Products and equipment for acne care. Desincrustation, steam, and extractions are all part of an oily and problem skin facial. AHA and BHA exfoliation treatments are also effective. Each client is treated individually according to their needs. Did you know? The blue light of LED therapy is beneficial for the treatment of acne. See Chapter 13, Advanced Topics and Treatments. Here are some products recommended for acne. Beta-hydroxy acid, salicylic acid. These products are found naturally in willow bark extract and are natural keratolytic agents, meaning they are able to dissolve keratin, improving the look and the feel of the skin. This ingredient differs from alpha-hydroxy acid in that it is more soluble in oil than water. This means that once the water from the product you are applying evaporates, salicylic acid will seek out oil, in this case sebum, and help to cleanse it further from the skin. Check for aspirin allergies before using salicylic acid. Figure 8.54. Beta-hydroxy acid, salicylic acid, treatment. Sulfur masks. These are effective products that exfoliate skin and dry blemishes. Check for sulfur allergies. AHA, glycolic, lactic, malic, citric, and tartaric acids. These products are used in different percentages to help dissolve dead skin cells to keep the skin surface exfoliated. Exfoliation also softens acne impactions. Vitamin A or retinol. Both retinol and retinol palmitate are forms of vitamin A. This topical vitamin benefits the skin by helping to reduce flaking and restore the appearance of skin suppleness. In a spa or salon, formulations should never exceed 30% retinol and should never be lower than 3.5%. Benzoyl peroxide. This ingredient releases oxygen that kills bacteria as well as helps exfoliate skin. Kojic acid. This is an ingredient derived from mushrooms that helps to brighten the appearance of the skin. Spot blemish treatments. These products include ingredients such as beta-hydroxyl acid, tea tree oil, and benzoyl peroxide that are applied just on blemishes after cleansing. Increased vitamin C. This oral vitamin has antioxidant value and healing effects. Acne care tips. Here are some suggestions for clients with acne. Eliminate comedogenic products. Oil-free does not mean non-comedogenic. Examine the ingredients on product labels to determine if they are appropriate for problem skin. Refer to Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection for ingredient information. Control oil through proper product usage. Do not irritate the skin with harsh products. Exfoliate the skin. Keep the skin clean and exfoliated to keep sebum and cells from building up. Beta or alpha hydroxy acids are beneficial. Do not overuse these products. Once a day is sufficient. Protect against environmental aggressors, dirt, grease, UV light, humidity, and pollution. Practice stress reduction and good nutrition. Have regular facials once a month or as needed. Home care for acne. Proper home care can usually help keep acne under control. However, when clients cannot achieve results with their home care routine, they may seek the aid of an esthetician or a physician. Figure 8.55. After the skin is analyzed, suggestions are given to the client specific to their needs. It is important for clients to follow the recommended home care routine as outlined by the esthetician. Treatments must be accompanied by a real commitment from the client to maintain their home care regimen. Figure 8.55. Proper home care is essential for the treatment of acne. It is important to ask clients not to pick at their blemishes. Explain to them that the skin is delicate and performing self-extractions will cause the infection to go deeper, possibly spread more rapidly, and perhaps cause permanent scarring. You cannot treat infected skin. Advise the client to first see a dermatologist to medically treat the infection. Home care will include a cleanser, an exfoliant, a mask, a toner, a lightweight hydrator, and a full-spectrum sun protection cream. In addition, Make sure recommended ingredients are not irritating or contraindicated. A foaming or gel cleanser with an exfoliant, AHA, salicylic acid, or benzoyl peroxide is the best choice. Use an astringent with alcohol to prevent infection. Apply a light, hydrating, oil-free moisturizer and sunscreen for balance and protection. A clay mask is recommended twice per week. A mask with camphor and sulfur also works well for oily skin. Other products may include a hydrating, soothing mask to balance the drying products. All home care includes an analysis of lifestyle to help the client better understand what some of their acne triggers might be. See Chapter 4, Disorders and Diseases of the Skin. By understanding the causes, the client is better prepared to follow a home care program. Caution. Performed incorrectly, extraction can cause excessive skin damage, infection, and scarring. Extraction techniques. Practicing proper extraction methodology is one of the most important skills an esthetician must learn. Furthermore, each state in the United States has specific requirements for aesthetic training and subsequent licensing, and each state regulates the type of treatment and implements permissible by state law. You must check with your individual state board to thoroughly understand the number of training hours and types of implements allowed in order for you to perform extractions as a licensed esthetician. Importance of infection control. Proper infection control is essential when performing extractions, and the process must be correctly executed before, during, and after for each treatment. A sterilizer or autoclave completely kills all microorganisms, including bacteria, viruses, fungi, and bacterial spores, with highly pressurized steam. All reusable implements should be placed in the autoclave between treatments. If you don't have a sterilizer or autoclave, use only disposable implements and dispose of these after every use so there is no risk of cross-contamination. Figure 8:56. In addition, a high-frequency machine is a useful and unique tool for acne-prone skin, helping prevent secondary lesions and decreasing the appearance of inflammation. Figure 8:56. An autoclave completely kills all microorganisms. Extraction training. In treating acne or blemished skin, the most important step for the esthetician is the effective cleansing and removal of blemishes. When the follicles are properly cleansed, the client's skin will begin to show marked improvement. It is important to explain to the client that you cannot always remove all blemishes during one treatment. Did you know? All areas of the forehead, the top of the nose, the chin, and the jawline have follicular walls perpendicular to the surface of the skin. The follicles are positioned this way on all flat surfaces. All other areas of the skin, such as the sides of the nose and cheeks, have slanted follicular shafts. Training and caution are needed before performing extractions. The skin must be exfoliated and warmed before extractions are performed. It is also imperative that the esthetician wear gloves during extractions and then change the gloves before performing the rest of the facial to prevent the spread of infection. Protective eyewear is also recommended in some instances. Proper extraction procedures are necessary to safely extract oil and debris from the follicles. Do not practice extractions without prior instruction or training. Gloves must be worn at all times. Extraction methods. There are 4 methods to use for extractions: forefingers wrapped with gauze, cotton swabs, cum-done extractors, and lancets. Figure 8:57. For the first 3 methods, press gently around the lesion. Figure 8:57. A metal cum-done extractor is an effective tool for extractions. Manual cum-done removal, gauze wrapped around gloved fingers, dampened with astringent, is useful for the majority of extractions. Cum-done extractors are metal tools used for open comedones and sebaceous filaments. Cotton swabs are smaller than fingertips and are especially useful around the nose area. Lancets are for the removal of milieu or pustules. Check with your state board to see if this is permissible. Important note: cysts and nodules must be treated by a dermatologist. Perform. Procedure 8 to 7: Performing extractions. To achieve optimum success when performing extractions, you must put pressure on the skin surrounding the follicular wall so that you can extract the impaction with the least trauma to the surrounding tissue. Understanding the angle of the various follicles in the different locations on the skin will enable you to perform extractions easily and effectively. Treatment for milia, closed comedones. As discussed in Chapter 4, Diseases and Disorders of the Skin, milia are small epidermal cysts and are often referred to as tiny whiteheads. Milia usually occur around the eyes, upper surface of the cheeks, and forehead. Your clients may have tried to get them cleaned out themselves, but with no luck. This is because milia are keratinized sebum trapped under the skin surface, and although it looks like it can be extracted easily, you may need the help of a lancet to get the milia out. A lancet is a small, sharp, pointed needle used to make a tiny opening in the epidermis to expose the milia. Figure 8:58. Always use a new sterile sealed lancet. Be sure the seal has not been broken. Again, a lancet is permissible only with permission by the state board. Improper lancet use may scar the skin or may cause infection. Figure 8:58. A lancet aids in the extraction of milia. Check-in. List 4 acne care tips you can suggest for clients with acne. Explain the methods that can be used for extractions as permitted in your stat. Perform an acne treatment procedure. The following is a basic outline of a facial that incorporates deep cleansing, cum-done extraction, and skin balancing treatments that will help oily, problematic skin get back on track to a beautiful, healthy complexion. Some steps may be omitted or rearranged, depending on the treatment goals and the client's needs. Products you will need. Cum-done extractor. Cotton. Cotton squares. Cotton swabs. Eye pads. Fresh linens. Trash can with closing lid. Gauze. Gloves. Hand cream. Lancet, where permissible by state law. Makeup remover. Mixing bowl. Robe for the client. Scissors. Sharps container. Sink or basin of water. Spatula. Unscented tissues. Step 1. Wash hands and put on gloves. Step 2. Perform deep cleansing. Cleanse skin using a soap-free formula that deep cleanses without causing dryness, preferably one that contains salicylic acid to gently exfoliate the skin. Figure 8:59. Cleansers should also contain soothing ingredients such as seaweed and green, white, and rooibos teas. Figure 8:59. Perform deep cleansing of the skin. Step 3. Analyze the skin. Use a magnifying lamp to check for open pores, open and closed comedones, pustules, milia, or any redness or irritation. If skin is irritated or sensitive, skip steaming. Step 4. Steam and apply serum. Steam the face while applying a gentle skin serum that combines exfoliating ingredients such as alpha and beta hydroxy acids with softening ingredients such as seaweed and natural extracts that help calm the appearance of the skin, such as chamomile and lavender. This can be applied in gentle effleurage movements. Did you know? Remember, the clogging in the sebaceous gland is a keratinaceous plug. Keratin is a hard protein like that found in your hair. We have to soften this keratin before we can do our extraction. It's like opening a bottle with a cork. Before you can remove the contents, you have to remove the cork. Step 5. Proceed with desincrustation. Soften the outermost layer of the skin before proceeding with extraction. This is because clients are often using dehydrating ingredients such as hydrogen peroxide on their skin at home to treat their acne pimples. The esthetician will most likely find that while the skin is oily, the skin is extremely tight with a lot of dead skin cell accumulation. Even the sebum inside the pores is dried out and dehydrated. You can injure the client's skin at this point if you try to extract a blackhead, open cum-done, in this state. The desincrustation solution is the first step in softening the sebum in order to perform a gentle but thorough extraction. Figure 8:60. Desincrustation is the first step in softening the sebum. Step 6. Perform extractions. The most important skill an esthetician must master is proper extraction. It must be performed in such a way as to not cause further damage to the skin or make the acne worse. Refer to Procedure 8-7, Performing Extractions for the full instructions on performing extractions. Choose an extraction method that is permitted by your state: manual cum-done removal, cum-done extractors, cotton swabs, or lancets are for removal of milia or pustules. Put pressure on the skin surrounding the follicular wall so that you can extract the impaction with the least trauma to the surrounding tissue. Figure 8:61. Perform extractions. Step 7. Apply astringent/toner. Now that extractions have been completed, saturate Esthetics wipes with astringent that contains a salicylic acid tea blend to soothe skin. Applying astringent is critical following extractions to help cleanse the skin, thereby reducing the possibility of secondary infection, and to rehydrate the skin. Do not rub the astringent in, but apply it lightly, paying special attention to the areas where you extracted. Step 8. Apply a clay-based mask for deep cleansing. Remove with towels. Follow with a clay-based mask to help deep cleanse the pores while helping to make skin feel soothed. Figure 8:62. Look for a mask that contains sea mud, zinc, and kaolin to help promote surface desquamation and help remove excess oils and debris which may contribute to breakouts. There may be some residual blood left on the skin from the extraction process, so continue wearing gloves and apply the mask with a spatula. Leave on for 7 to 10 minutes and remove by applying warm, moist cotton or towels over the entire face, letting the moisture soak in for a moment, then removing the mask using quick, gentle strokes. Remove any residue with astringent and Esthetics wipes. Figure 8:62. Clay-based mask application. Did you know? Never force extractions. Most clients will tolerate only 10 minutes of extractions. Check to make sure they are comfortable with the procedure if you intend to work longer. Once the skin becomes dry and resistant, it is time to stop the procedure. At the end of your service, book the client's next appointment so that you can continue their extractions during their next treatment. Step 9. Apply a soothing mask. Remove with wet cotton. Follow with a soothing mask, such as a calamine mask, combined with tea extracts, zinc, and organic buttermilk powder to help reduce the appearance of redness on the skin. Figure 8:63. Leave on for 10 minutes and perform a relaxing 10-minute hand massage. Your client will appreciate it after the extractions. Figure 8:63. Calamine mask application. After 10 minutes, remove the mask with wet cotton and clean warm water. Follow up with an astringent that helps tone the skin's appearance. Note: a client should never leave the salon with red, irritated skin after a facial treatment. Step 10. Apply moisturizer. After masks, we are ready for a moisturizer that does not clog skin while it helps to lessen the appearance of oil. Remember that the client was just deep cleansed and is about to go out into the environment. It is key for the client's skin to be moisturized upon completion of the facial treatment to further reduce dryness and the appearance of irritation. Use a mattifying moisturizer that is formulated with zinc as well as squalane, a moisturizing ingredient found in sebum as essential fatty acids to help restore moisture yet reduce oil and shine. Step 11. Perform galvanic or high-frequency treatment. High-frequency germicidal rays can be applied to the skin for faster healing time of lesions and prevention of secondary infections. Again, please check with your local and state boards regarding use of galvanic and high-frequency devices. Contraindications to using high-frequency include pregnancy, high blood pressure and/or heart conditions, and patients with a high amount of metal in their mouth from dental procedures. Place your index finger on the electrode and apply to the client's entire face in circular motions, moving over the entire face for a total of 3 to 5 minutes. Figure 8.64. Remove the index finger when the electrode makes contact with the skin. You can also target specific areas by lifting the electrode on and off the skin. You may also incorporate this step right after extractions. Figure 8.64. High-frequency treatment. Step 12. Finish with the post-treatment consultation. Education and knowledge are key in helping clients with oily skin. The client should be advised of the importance of in-salon treatments and following a home care program especially designed for them. Additional important points to cover. Break bad habits such as picking and squeezing the skin. Over-cleansing can be detrimental to acne-prone skin. It can further irritate the skin, stripping essential moisture and causing inflammation and additional risk of infection. Maintain a healthy diet. New research has found that dairy and fermented or yeast-based foods can exacerbate acne conditions. These include aged cheeses, highly processed milk, wine, beer, champagne, and mushrooms. Skincare experts now recommend probiotics to counteract unhealthy bacteria living in the stomach lining and the resulting inflammation that can increase acne flare-ups. Avoid sunbathing, and not just because of the damaging UV light. Once considered part of an acne treatment program, UV light can initially dry up excess sebum and reduce pustules, but can lead to a cascade of reactions that actually increase oil production and sebum buildup on the skin. Check in. Explain steps to take before extractions. What are the 4 important points to cover in the post-treatment consultation with a client who has acne? Discuss men's skincare treatment options. As men now are spending more time and money than ever before on improving their appearance as they seek success in both their professional and social lives, estheticians need to educate themselves on the key differences between male and female skin needs. A major skin complaint spa owners hear from their male clientele is razor burn. Men tend to have sensitive skin that they have mistreated for years. The spa is the place to educate them on how to shave properly and to protect their skin before and after shaving. Traits of men's skin. Men often have larger pores and more active sebaceous glands. Their skin tends to be characterized by excess oil and numerous blackheads. Figure 8.65. At the same time, male skin often can become dehydrated from harsh soaps and shampoos, as well as from frequent hot showers. Ironically, their skin can both be excessively oily and have surface dryness. Men need products and treatments that are hydrating but also offer deep pore cleansing and pore refining. Figure 8.65. Men's skin can be characterized by excess oil and blackheads. Men also are concerned with aging. They often have hyperpigmentation from years of outdoor activities without wearing sunscreen. They may have crow's feet and dark under-eye circles from long days spent squinting at computer screens. The baby boomer male is being confronted with middle age. In addition, male millennials, now moving into the 25-plus age group, are coming into the workplace with a more evolved approach toward grooming, where it's okay to care about the condition of the skin. Focus on tips for men's treatments. Avoid using perfumed and fragrant products in the facial room. Men already may be feeling a bit apprehensive about having a facial, so keep the service as clean and simple as possible. Cater to specific needs by incorporating grooming services such as trimming or waxing eyebrows, nostril hair, and ear hair. Men do not want to walk out of a spa with red, blotchy skin caused by an aggressive extraction session. Additional services to calm skin, apply products, and even concealing makeup should be considered. When deciding on a retail line for males, keep in mind the kinds of packaging that many men prefer. It should not be pink or red, but, rather, sleek and simple. Choose products that can be sprayed on quickly, and swap jars for bottles with pumps so they can be easily packed in gym bags and for trips. Retail products should be merchandised to emphasize qualities such as non-greasy, rinses off easily, and protects the skin. Perfume-free, color-free, calming, and stress-reducing are good buzzwords to use when describing offerings that will appeal to men. Marketing to men. Men's skincare needs are just as important as women's. It is becoming more common for men to use spa services and to take care of their skin. Estheticians need to take a simple, direct approach when discussing skincare with their male clients. Men, in general, want to use only a few products on a daily basis. Figure 8:66. Take a direct approach when discussing skincare with male clients. Male clients are willing to follow suggestions and want a basic, consistent routine. They tend to be loyal customers. Male clients represent a growing percentage of a spa's business. The challenge is to attract male clients so that they will make the initial visit in the first place. One way to attract male clientele is to offer special services designed just for them. Make them feel comfortable, and tactfully assure them that it is normal for men to have spa services and practice good skincare habits. Conduct consultations privately, without discussing products and treatments out in the reception area where other clients may be present. Some salons and spas cater to men only. The male market will continue to grow as men feel more comfortable about receiving services. Figure 8:67. In fact, there is a rising trend of barbershop services that provide skincare treatments after shaving. Figure 8:67. The male skincare market continues to grow. Did you know? Using the term skin treatment rather than the term facial is a better way to promote men's services. Men's skincare products. To build the market, a salon or spa could carry a specific line of men's skincare products. Most unisex product lines will work as long as the packaging and fragrance are not overly feminine. Men typically have larger sebaceous glands and oilier skin. They also need sun protection. Men may tend to neglect their skincare because it is not considered masculine or a priority. Clients who are especially pleased with visible treatment results are more willing to try a home maintenance program. When considering a men's skincare line, keep in mind several key points. Be sure the products are basic and the routines are simple. Men do not want highly fragranced, feminine products. For instance, lotions need to be light, be without fragrance, be highly absorbent, and have a matte finish. Most men do not like the greasy feeling of some products. Figure 8:68. Products should be basic with simple routines. Men prefer simple routines and multi-purpose products. They would rather have a moisturizer that they can use day and night, or one that already contains full-spectrum sunscreen. They also like the foaminess of soaps, so a foaming cleanser is a good choice. They can use a toner just like they would an aftershave lotion. They should then apply a light moisturizer with sunscreen. Give male clients specific instructions on how and when to use products. Keep the following tips in mind when working with male clients. Tubes and pumps that are easy to open are more male-friendly than jars are. His home care regimen should begin with only 2 products, a cleanser and a hydrating lotion. If he wants 3, add sunscreen. As he grows accustomed to the regimen and sees favorable results, he will most likely add to his regimen by purchasing a toner, eye cream, and a mask. Educate him on sun protection and skin cancer facts, even if he chooses not to purchase sunscreen. Estheticians can suggest that male clients shave in a downward direction, in the direction of the hair growth pattern, because it is less irritating. Once he is accustomed to receiving treatments and using products, your male client will be more likely to use an eye cream if he is taught how. While men may be conscious of lines and wrinkles around their eyes, they seldom request an eye product. Estheticians can point out the benefits of these and other products. Professional treatments for men. Depending on the client's skin conditions, you can offer various treatments. Most men love steam and the brush machine. Even if a client's skin is slightly sensitive, he will prefer the assertiveness of a brush and foamy cleanser. A firmer touch and deeper massage are also needed on male skin. Figure 8:69. The brush machine is a popular treatment for male clients. There are some other important aspects of men's facials. First, sponges and towels are more appropriate for a man's face. Cotton pads and gauze will grab the beard hair, leaving particles clinging to the face. Shaving before a facial actually makes the skin more sensitive. On freshly shaven skin, exfoliating products or techniques, including strong sensitizing agents such as alpha-hydroxy acids and microdermabrasion, may be contraindicated. Professional movements during a man's facial should flow with the hair growth. For example, most massage movements in the beard area should move downward, not upward. This goes against the typical aesthetic procedure of lifting movements up the neck and face. Overall, the beard area tends to be relatively sensitive due to shaving lotions that contain perfume, alcohol, or other similar substances. Shaving itself is also quite abrasive to the skin, so men need more calming and healing products. Folliculitis. Folliculitis is inflammation of the hair follicles. This can be a problem for many men, especially if they have very coarse or curly beard hair. Folliculitis is an infection characterized by inflammation and pus. Improper shaving may also cause folliculitis barbae, where the hair grows slightly under the skin and is trapped there, causing a bacterial infection. The treatment goal for this condition is to alleviate the irritation, dry up and disinfect the pustules, and desensitize the area. A soothing gel mask is probably the most comfortable product for a male client to use in this area. Pseudofolliculitis, also known as razor bumps, resembles folliculitis without the infection. This condition also results from improper shaving techniques. There are products on the market for ingrown hairs that help exfoliate and keep the follicles clean. Exfoliating is necessary to keep the follicles open. A foaming cleanser will also help a man's beard area, figure 8.70. Estheticians can help male clients by keeping them informed of how to take care of their skin on a regular basis. Figure 8.70. A foaming cleanser will more easily cleanse the beard area. Check in. What are the key points to consider when choosing skincare products for men? Procedure 8-1, pre-service, preparing the client for treatment. After the successful completion of this procedure, you will be able to demonstrate a professional client draping. Equipment, implements, and products. Note, actual products will vary depending on the client's recommended treatment plan. Refer to full list of supplies for a basic facial on page 262. Equipment. Facial equipment, towel warmer, steamer, magnifying lamp. Covered trash container. Implement. 1 headband/protective cap. 1 bowl warm water. 2 hand towels. 2 twin-size flat bed sheets. 2 disposable brushes. 1 rubber mixing bowl. Blanket. Bolster. Client charts. Gloves. Gown or wrap. Hairpins. Liquid soap at sink area. Plastic bag for jewelry. Pillow and pillowcase. Robe. Slippers. Spatulas. Products. 1 cleanser. 1 astringent or toner. 1 moisturizer. 1 serum. Mask. Preparation. Perform procedure 7-1, pre-service, preparing the treatment room to set up the treatment room and supplies. Procedure 1. Greet the client in the reception area with a warm smile and in a professional manner. Introduce yourself if you've never met, make eye contact, and shake hands. Be sure your handshake is firm and sincere. 2. Discuss the completed client intake form with the client and confirm their service. Ask about any client concerns and set the expectations for today's service. 3. Ensure there are no contraindications for the treatment scheduled. Have your client sign a consent form before every service. 4. Escort the client to the dressing area or the treatment room to change. Inform the client where to place personal items. Ask the client to remove all jewelry and place in a sealable plastic bag to secure items. Due to liability issues, do not handle the client's jewelry. Have the client remove contact lenses as well, optional, if wearing them. 5. Provide them with a robe, spa wrap, and slippers. Explain which clothing may need to be removed and show them how to put on the spa wrap. Indicate where to go once they have changed. Then allow them to undress privately. Always knock before re-entering the room. 6. Depending on the service to be performed, instruct the client to lie either face down or face up on the treatment table or to take a seat in the treatment chair. 7. Place a bolster under the bottom sheet, below their knees, to relieve pressure on the lower back if they are facing up. This alleviates pressure on the lower back. If your client is facing down, place a rolled towel or small bolster under their ankles. 8. Bring the second sheet up and blanket across the décolleté. Then place a hand towel across the chest on top of the covers. 9. Secure a disposable headband, towel, or other head covering around the client's head to protect the hair, making sure all the hair is off the face. To drape the head with a towel, follow steps A, B, and C. During setup in procedure 7-1, you placed a hand towel on the headrest. Fold the towel into a triangle from one of the top corners to the opposite lower corner, and place it over the headrest with the fold facing down. A. When the client is in a reclined position, the back of the head should rest on the towel, so that the sides of the towel can be brought up to the center of the forehead to cover the hairline. B. Use a disposable headband to hold the towel in place. Use a spatula or the edge of your finger to make sure that all strands of hair are tucked under the towel, that the earlobes are not bent, and that the towel is not wrapped too tightly. 10. Wash your hands with soap and warm water as detailed in procedure 5-1, proper hand washing located in Milady Standard Foundations. Always wash your hands and put on gloves before starting any treatment. 10. 11. Proceed with the next steps in your facial treatment. Procedure 8-2, remove eye makeup and lipstick. Equipment, implements, and products. Gather the following supplies and products for this procedure. Implements: liquid hand soap and hand sanitizer. Covered waste container. Facial towels. Headband and head wrap. Clean linens. Bolster. Plastic sealable bag for personal items. Single-use items. Gloves. Esthetics wipes, 4x4 or 2x2 cotton or gauze pads, or disposable sponges. Cotton swabs. Spatula. Tissues, unscented. Products: eye makeup remover or cleanser. Facial cleanser. Eye and makeup removal preparation. Perform procedure 7-1, pre-service, preparing the treatment room, and procedure 8-1, pre-service, preparing the client for treatment. Procedure: A. Eye makeup removal. Note, if the client is wearing contacts, do not remove the eye makeup. Be especially gentle when cleansing the eyes because the skin around the eyes is very sensitive and can become irritated. Do not get cleanser into the eyes. 1. Saturate 2 cotton rounds with a mild cleanser, usually a pH of 7.0 to 7.2 is recommended, or makeup remover. You also have the choice of using gloved hands to apply the cleanser. 2. Ask the client to close their eyes. Start with the client's left eye. With one hand, gently raise and hold the client's eyebrow. With the cotton pad in your other hand, gently wipe across the top of the eyelid from the nose outward. Use downward movements with the cleansing pad to cleanse the eyelid and lashes. Gently rinse with cotton or gauze pads. 3. While cleansing the eyes, rotate the pad to provide a clean and used surface. Repeat step 2 as necessary to remove eye makeup. 4. Wipe under the eyes, sweeping in toward the nose. Remove any makeup underneath the eyes and along the lash line with a cotton swab or pad. Place the edge of the pad under the lower lashes at the outside corner of the eye, and slide the pad toward the inner corner of the eye. The mascara will gradually work loose and can be wiped clean. Always be gentle around the eyes, never rub or stretch the skin, as it is very delicate and thin. 5. Make a complete circular pattern around the eye. Use the pad or a cotton swab to wipe inward under the eye toward the nose and then outward over the top of the eyelid. 6. Rinse the eye area with a pad or cotton round soaked, not dripping, in warm water to remove the eye makeup remover. Make sure the remover is rinsed off thoroughly. B. Lipstick removal. 7. To remove the majority of the lipstick, first support the lip and wipe away the lipstick using a dry tissue, then discard the tissue. 8. Then, apply cleanser to a gauze or cotton pad. With your left hand, hold taut the left side of the client's mouth. Wipe from the corner to the center to prevent the lipstick from being wiped out onto the skin surrounding the mouth. 9. Repeat the procedure on the other side until the lips are clean. Proceed with the next step of the basic facial. Procedure 8-3, applying a cleansing product. Equipment, implements, and products. Implements. Hand sanitizer/hand soap. Covered waste container. Spatula. Facial towels. Headband and head wrap. Clean linens. Bolster. Single-use items. Gloves. Plastic resealable bag for personal items. Products. Eye makeup remover or cleanser. Facial cleanser. The following method of application is used when applying cleansers, massage creams, treatment creams, serums, and protective products. If possible, use both hands at the same time for a more even and efficient technique. Use either circular motions or straight, even strokes for cleansing. Preparation. Perform procedure 7-1, pre-service, preparing the treatment room, and procedure 8-1, pre-service, preparing the client for treatment. Procedure 1. Apply warm towels, optional. Check the temperature and apply one towel to the décolleté and one to the face. Leave on for at least 1 minute and then remove. 2. Choose a cleanser appropriate to the client's skin type. Use a spatula to remove the product from the container unless using a squirt or pump bottle. Apply approximately 1 teaspoon of the product to the fingers or palms of the hand and spread evenly between your gloved hands and fingertips. 3. Use circular motions to distribute the product onto the fingertips. You are now ready to apply the product to the client's décolleté, neck, and face. Cleanse each area using 6 passes. If starting on the décolleté, start in the center and work out to the sides moving up to the neck. Be guided by your instructor. 4. Start applying a small amount of the product by placing both hands, palms down, on the neck. Slide hands back toward the ears until the pads of the fingers rest at a point directly beneath the earlobes. While applying the product, it is suggested that hands are not lifted from the client's face until you are finished. 5. Reverse the hands, with the backs of the fingers now resting on the skin, and slide the fingers along the jawline to the chin. 6. Reverse the hands again, and slide the fingers back over the cheeks and center of the face until the pads of the fingers come to rest directly in front of the ears. 7. Reverse the hands again, and slide the fingers forward over the cheekbones to the nose. Cleanse the upper lip area under the nose with sideways strokes from the center area moving outward. Then slide up to the sides of the nose. 8. With the pads of the middle fingers, make small, circular motions on the top of the nose and on each side of the nose. Avoid pushing the product into the nose. 9. Slide the fingers up to the forehead and outward toward the temples, pausing with a slight pressure on the temples. Slide fingers across the forehead using circles or long strokes from side to side. Slowly lift your hands off the client's face. 10. Proceed to procedure 8 to 4, removing products if the product used needs to be removed, for example, a cleanser or massage cream. Procedure 8 to 4, removing products. Implements and products. Gloves. 4x4 aesthetics wipes, disposable sponges, or warmed towels from a hot towel cabinet. Removing products. To remove products, rinse each area at least 3 to 6 times. Some estheticians prefer to use wet aesthetics wipes when removing product. Others prefer to use towels. Both methods are correct and equally professional, and many estheticians use both methods. Facial movements are generally done in an upward and outward direction from the center to the edges of the face. Procedure 1. Starting at the décolleté, cleanse sideways and up to the neck. When removing the cleanser, mask, or exfoliant, you should make 3 passes or however many are necessary until no residual makeup shows. 2. Cleanse the neck using upward strokes. To keep the pad from slipping from the hand, pinch the edge of the pad between the thumb and upper part of the forefinger. It is important that most of the surface of the pad remain in contact with the skin. Do not exert pressure on the Adam's apple in the center of the neck. 3. Starting directly under the chin, slide along the jawline, stopping directly under the ear. Repeat the movement on the other side of the face. Alternate back and forth 3 times on each side of the face, or do the movement concurrently by using both hands at the same time. 4. Starting at the jawline, use upward movements to cleanse the cheeks. 5. Continue the upward movement and cross over the chin to the other cheek if you are using only one hand. 6. Continue the cleansing movement with approximately 6 strokes on each cheek. 7. Under the eyes, use inward motions to avoid tugging at the eye area. 8. Cleanse the area directly underneath the nose by using downward and sideways strokes. Start at the center and work outward toward the corners of the mouth. Rinse at least 3 times on each side of the face. 9. Starting on the bridge of the nose, cleanse the sides of the nose and the area directly next to it. Use light, outward movements. 10. Starting at the center of the forehead, move outward to the temples. Apply a slight pressure on the pressure points of the temples. Repeat the movement 3 times on each side of the forehead. 11. Check the face to make sure there is no residue left on the skin. Feather over the areas of the face with the fingertips to check that it is well rinsed. Discard all used supplies in the trash can. 12. Cover the client's eyes with eye pads and prepare to perform the skin analysis. Procedure 8 to 5, performing the basic facial. Equipment, implements, and products. Equipment. Facial equipment, towel warmer, steamer, magnifying lamp. Sharps container. Supplies. EPA-registered disinfectant. Hand sanitizer/hand soap. Covered trash container. Bowls, if sink is not available. Spatulas. Fan and mask brush, non-porous and must be able to be disinfected, example non-wooden. Implements. Client charts. Distilled water for steamer. Hand towels. Clean linens and blanket. Headband/head wrap/or protective cap. Client wrap. Bolster. Single-use items. Aesthetics wipes, 4x4 and 2x2 gauze or cotton, or disposable sponges. Cotton rounds or squares. Cotton swabs. Paper towels. Gloves. Tissues, unscented. Distilled water for steamer. Products. Eye makeup remover. Facial cleanser. Optional, exfoliant. Masks. massage lotion, toner, moisturizer, sunscreen. Optional, serums, eye cream, lip balm, extraction supplies. Now that you have practiced the preliminary steps in cleansing, it is time to put it all together in a complete facial. The steps for performing a basic facial treatment are listed here. Facial procedures vary, so be guided by your instructor. Caution: wearing gloves throughout the entire facial service is required by OSHA due to the possibility of bloodborne pathogen exposure. Never remove products from containers with your fingers. Always use a spatula. Do not touch fingertips to lids or openings of containers. Clean and disinfect product containers before and after each service. Preparation. Perform procedure 7-1, pre-service, preparing the treatment room, and procedure 8-1, pre-service, preparing the client for treatment. Preheat the steamer ahead of time. Check that the water level is at the appropriate fill line. Procedure 1. Wash your hands and apply gloves. 2. Apply warm towels, optional step. After checking the temperature, apply one towel to the décolleté and one to the face. Hold the ends of the towels with both hands on either side of the face. Lay the center of the towel on the chin and drape each side across the face with the towel edges draped over to the opposite corner across the forehead. To remove, lift each end and remove. For product removal, use the towels over the hands as mitts. Be guided by your instructor on this method. 3. Remove eye makeup and lipstick. As learned in procedure 8-2, remember to ask about contact lenses before putting product on the eyes. If the client is wearing contacts, do not remove the eye makeup. 4. Perform facial cleansing, steps 4, 5, 6, 7, 8, 9, and 10. Remove about 1/2 to 1 teaspoon of cleanser from the container, with a clean spatula if it is not a squirt top or pump-type lid. Place it on the fingertips or in the palm and then apply a small amount to your gloved fingertips. This conserves the amount of product you use. 5. Starting at the neck or décolleté and with a sweeping movement, use both hands to spread the cleanser upward and outward on the chin, jaws, cheeks, and temples. 6. Spread the cleanser down the nose and along its sides and bridge. Continue to the upper lip area. Cleanse the upper lip area under the nose with sideways strokes from the center area moving outward. 7. Make small, circular movements with the fingertips around the nostrils and sides of the nose. Continue with upward sweeping movements between the brows and across the forehead to the temples. 8. Apply more cleanser to the neck and chest with long, outward strokes. Cleanse the area in small, circular motions from the center of the chest and neck toward the outside, moving upward. Try to use both hands at the same time on each side when applying or removing product. 9. Visually divide the face into left and right halves from the center. Continue moving upward with circular motions on the face from the chin and cheeks, and up toward the forehead using both hands, one on each side. 10. Starting at the center of the forehead, continue with the circular pattern out to the temples. Move the fingertips lightly in a circle around the eyes to the temples and then back to the center of the forehead. Lift your hands slowly off of the face when you finish cleansing. 11. Remove the cleanser. Start at the neck or forehead and follow the contours of the face. Move up or down the face in a consistent pattern, depending on where you start, according to the instructor's procedures. Remove all the cleanser from one area of the face before proceeding to the next. Under the nostrils, use downward strokes when applying or removing products to avoid pushing product up the nose. This is uncomfortable and will make the client tense. 12. Make sure there is no residue left on the skin. Blot your hands on a clean towel and touch the face with dry fingertips to check. 13. Analyze the skin, steps 13, 14, and 15. Cover the client's eyes with eye pads. Try not to cover what you need to look at around the eyes. 14. Position the magnifying light where you want it before starting the facial, so that you can easily maneuver it over the face. Turn on the lamp away from client before lining it up over the face. 15. Note the skin type and condition, sensitivity, hydration, elasticity, and feel the texture of the skin. Remember to look, touch, ask and listen. Based on the skin analysis, the remainder of the products will be selected as well as the treatment objectives. 16. Cleanse the face again, optional. Some treatment protocols do not include this second cleansing. Be guided by your instructor. 17. Exfoliation, optional. If exfoliation is part of the service, it could be done at this time while steaming. Tone after removing exfoliant to rebalance pH of the skin. 18. Massage the face, steps 18, 19, 20, 21, and 22. Use the facial manipulations described in Chapter 9, Facial Massage. Select a water-soluble massage cream or product appropriate to the client's skin type. 19. Use the same procedure as you did for product application to apply the massage cream to the face, neck, shoulders, and chest. Apply the warmed product in long, slow strokes with fingers or a soft fan brush, moving in a set pattern. 20. Perform the massage as directed. 21. Remove the massage medium. Use warm towels or 4 times for aesthetics wipes and follow the same procedure as for removing other products or cleanser. 22. Steam the face using the steamer, steps 22 and 23. Skip to step 24 if using towels. The steamer should be preheated at the start of the facial. Wait for it to start steaming, and then turn on the second ozone button if applicable while steaming. Remember that steam should be avoided on sensitive skin types. 23. Check to make sure the steamer is not too close to the client. It should be approximately 18 inches away, and that it is steaming the face evenly. If you hold your hands close to the sides of the client's face, you can feel if the steam is reaching both sides of the face. Steam for approximately 5 to 10 minutes. Turn off the steamer immediately after use. Caution. Keep the steamer facing away from the client until it is steaming to avoid potential spitting of water, which may happen if the machine is overfilled or not maintained properly. 24. Steam the face using towels. If using towels in place of steam, remember to test them for the correct temperature. Ask the client if they are comfortable with the temperature. Towels are left on for approximately 2 minutes or until they begin to cool. Steam or warm towels should be used carefully on cuprose skin. 25. Perform extractions if needed. Extractions are done immediately after the steam, while the skin is still warm. Refer to the extractions section of this chapter to incorporate this step into your basic facial procedure if it is applicable to your facility. 26. Apply a mask, steps 26, 27, 28, and 29. Choose a mask formulated for the client's skin condition. Remove the mask from its container and place it in the palm or a small mixing bowl. Use a clean spatula or brush, if necessary, to prevent cross-contamination. Warming the mask is recommended for better results as well as the client's comfort. 27. Apply the mask with a brush or spatula, usually starting at the neck. Use long, slow strokes from the center of the face, moving outward to the sides. 28. Proceed to the jawline and apply the mask on the face from the center outward. Avoid the eye area unless the mask is appropriate for that area. 29. Allow the mask to remain on the face for approximately 7 to 10 minutes. 30. Remove the mask. Use warm moist towels or 4 times for aesthetics wipes for removal. Cream-based masks can be wiped off, while clay masks can be removed with a mummy-style mask. Some masks may peel off, such as alginate or sheet masks. 31. Apply the toner. Apply the toner product appropriate for the client's skin type. 32. Apply serums as well as eye and lip treatments. Serums as well as eye and lip creams are optional for application before the final moisturizer. 33. Apply a moisturizer and an additional sunscreen as appropriate. 34. Post-consultation and home care. End the facial by removing your gloves and quietly letting the client know you are finished. Give the client instructions for getting dressed. Have the client come out to the reception area when they are ready to discuss the home care products and regimen. Post-service. Complete procedure 8 to 9, post-service procedure and procedure 7 to 2, post-service, cleanup and preparation for the next client, including advising the client, promoting products, scheduling a next appointment, thanking the client, and cleaning and setting up the treatment room. Procedure 8 to 6, applying and removing the cotton compress. Implements and products. 4x4 cotton squares. Basin for clean water. Product. Tissues. Toner. Note, this procedure is outdated but some licensing boards may still test on it. Proper removal of facial masks is critical. By creating a cotton compress, also referred to as a cotton mummy mask, you are continuing the calming and soothing benefits of the facial. The use of disposable cotton will maintain a clean environment. Procedure 1. After the mask or product has set for the appropriate time, take 1 cotton 4x4 square, open to 4x8, and saturate with water. 2. After squeezing out excess water, place the cotton lengthwise, first covering the neck. 3. Saturate a second piece of cotton with water and make a small opening for the mouth. Place across the chin and mouth from one side of the mandible to the other just below the nose. 4. When placing the third piece of cotton over the bridge of the nose and across the eyes, be sure to leave the nostrils exposed and airways open. 5. Place the fourth piece of wet cotton across the forehead, covering from temple to temple and cheek to cheek from one zygomatic bone to the other. Keep the cotton moist to help loosen mask for flawless removal, but not soaking wet to avoid dripping down the client's neck. 6. To remove the mummy mask, starting at the forehead, use a flat hand to wipe the product from one side of the face to the other. If you are right-handed, remove from left to right, if left-handed, right to left. 7. Fold the cotton under as you are removing the mask, as this will pick up more of the product and assist in quicker and cleaner removal. 8. Repeat the same movement on the cheek and mandible area. Finish removing from your client's cheek and nose area. 9. Remove the product and cotton from the neck. Use more cotton to remove any remaining residue. 10. Once residue is removed, refresh skin with hydrating mist or the appropriate toner/astringent, and then blot with tissue. Procedure 8 to 7, performing extractions. Implements and products. Esthetics wipes, 4x4 or 2x2 gauze or cotton. Gloves. Astringent. Other appropriate facial supplies, products, and equipment. Access to water or basin of water. Cotton swabs. Lancet. Sharps container. Extractions are performed during a treatment only after the skin has been cleansed and prepared for cum-done removal. This preparation can include exfoliation, desincrustation, and steaming. These methods help loosen the curtinaceous plugs within the follicle to help make the extractions easier. Never perform extractions for more than 10 minutes. It will make the client too uncomfortable and could be too aggressive to the skin. Preparing pre-made pads. If you are using 4x4 or 2x2 pre-made pads, apply astringent to pads, without oversaturating them, and wrap around your fingers. Always wear gloves during extractions and during the entire facial treatment. Preparing for extractions. Extractions must be performed in such a way as to not cause further damage to the skin or make the acne worse. 1. Wash hands and put on a new pair of gloves. Gloves are critical here because this is an invasive procedure. 2. Place eye pads over the client's eyes. 3. Position the magnifying lamp over the client's face. Always look through a magnifying lamp when performing extractions. This will protect you from any debris that come from the clogged pore. Again, advanced acne such as cysts and nodules should be treated only by a dermatologist. 4. Proceed with manual cum-done removal, using the cotton swab technique, cum-done extractor, or a lancet as permitted by your state board regulations. A. Manually removing comedones. Prepare the client's skin. Extractions are performed during a treatment after the skin is warmed and prepared/softened with product. 1. Wrap your fingers with cotton or gauze slightly moistened with a few drops of astringent at the tips. 2. For proper removal of comedones, use the side of your fingertips to exert firm pressure on the skin surrounding the blackhead or cum-done, applying slight pressure from side to side, alternating angles to gently lift the cum-done from the follicle opening. Cum-done extractors can also be used for this. Be guided by your instructor. Do not squeeze with your nail, only the side of your finger. 3. Start at the chin. On a flat area, press down, under, in, and up. Work around the plug, pressing down, in, and up. Bring fingers in toward each other around the follicle without pinching. Place the cum-done on a tissue and proceed to other areas. 4. Nose. Slide fingers down each side of the nose, holding the nostril tissue firmly, but do not press down too firmly on the nose. The fingers on top do the sliding, while the other one holds close to the bottom of the follicle. Do not cut off the airflow to the nostrils. 5. Cheeks. Slide fingers together down the cheek, holding each section of the skin as you go. The lower hand holds and the other hand slides toward the lower hand. 6. Forehead, upper cheekbones. Extract is on the chin, press down, in, and up. 7. Dispose of gloves and supplies properly. Change gloves to continue the facial treatment. B. Using the cotton swab technique. An alternative to cum-done removal is with cotton swabs. 1. Hold the cotton swabs with your index finger and thumb and gently press down on both sides of the follicle. 2. If the contents do not expel right away, move the swabs from side to side and the debris will gently lift up. Do not apply too much pressure, as it can bruise the client's skin. In both cases, if the contents are still not expelling, simply leave the cum-done for the next treatment and proceed to the next area of concern. C. Cum-done extractor. 1. To use the cum-done extractor, place the loop over the lesion so that the lesion is inside the loop. 2. Press gently next to the lesion to push it up and out. Be aware that the pressure exerted can traumatize tissues. The follicle walls can rupture, spilling sebum and bacteria into the dermis. This debris can cause infection and irritation that leads to the start of even more blemishes. D. Extracting with lancets. Please check with your regulatory agency to see if you are permitted to use lancets in your state. When a lesion is sealed over, as in old blackheads and closed comedones, a small gauge needle or lancet is used for extraction. 1. Wrap the index fingers with cotton or use sterile cotton swabs. 2. Hold the lancet parallel to the surface of the skin or at a 35° angle and gently pierce the skin horizontally to release sebum. If you prick into the skin in a downward motion, you can cause scarring. 3. After piercing the skin horizontally, gently press down on both sides of the milia and remove it. 4. Dispose of the lancet in the biohazard containers, also known as sharps boxes. Do not reuse the lancet. Procedure 8 to 8, applying a sheet mask. Implements and products. Gloves. Serums appropriate for client's skin, optional. Sheet mask. Other appropriate facial supplies, products, and equipment. Procedure. When you have reached the masking step in the facial treatment, you will perform the following steps. 1. Apply the serum of your choice. This is optional, as you may choose to just apply the sheet mask directly to the face. 2. With a new pair of gloves, open the sheet mask packet and place the open packet on your station. 3. Beginning at the chin, remove the backing on the sheet mask. Apply the sheet mask in a uniform format, smoothing the mask onto the face such that the mask is optionally positioned to ensure all areas of the face are benefiting from the sheet mask. 4. Process the mask according to the manufacturer's recommended processing time. 5. Remove the mask and proceed with the next steps in your facial treatment. Procedure 8 to 9, post-service procedure. A. Advising clients and promoting products. 1. Before the client leaves your treatment area, ask them how they feel and if they enjoyed the service. Explain the conditions of their skin and your ideas about how to improve them. Be sure to ask if they have any questions or anything else they'd like to discuss. Be receptive and listen. Never be defensive. Determine a plan for future visits. Give the client ideas to think over for the next visit. 2. Advise the client about proper home care and explain how the recommended professional products will help to improve any skin conditions that are present. This is the time to discuss your retail product recommendations. Explain that these products are important and how to use them. Schedule next appointment and thank client. 3. Escort the client to the reception desk and write up a service ticket for the client that includes the service provided, recommended home care, and the next visit/service that needs to be scheduled. Place all recommended home care products on the counter for the client. Review the service ticket and the product recommendations with your client. 4. After the client has paid for their service and home care products, ask if you can schedule their next appointment. Set up the date, time, and type of service for this next appointment, write the information on your business card, and give the card to the client. 5. Thank the client for the opportunity to work with them. Express an interest in working with them in the future. Invite the client to contact you should they have any questions or concerns about the service provided. If the client seems apprehensive, offer to call them in a day or two in order to check in with them about any issues they may have. Genuinely wish them well, shake hands, and wish them a great day. 6. Be sure to record service information, observations, and product recommendations on the client record, and be sure you return it to the proper place for filing. 7. Continue with setting up for the next service or end-of-day checklist as outlined in Procedure 7 to 2, post-service, cleanup and preparation for the next client.